Good morning, good afternoon, good evening, everyone, wherever you are in the world. My name is Tikki Pang. I would like to welcome all of you to this series of webinars hosted by the Head Foundation on the theme of COVID-19, what is next? This is the fourth webinar moderated by me in this series. To begin today's session and to place what we're going to discuss in context, we would like to begin by showing you a short video of what were the highlights of the previous webinars. So I hope you will enjoy this video.
A supply shock, a demand shock, a financial market shock, an international trade shock. It is every shock that you can imagine studying, all coming together.
Some of the modeling done by my colleagues showed that if nothing was done, if we live life as normal, then after about 80 days, we would see almost 1.2 million infections in Singapore.
We become very myopic, we become very self-centered. We find it very difficult to think about others. We find it very hard to make long-range plans. And in this situation, we are being asked to rise above ourselves and be better for the community and for society.
We rediscover our neighborhood. We rediscover our cultural roots, our ecological environment, and many other things. And that, for me, it could be a chance, a new chance for the engagement of citizens in their own environment.
The ability to transmission is higher, COVID-19 than SARS. So SARS disappeared, but now most of the immunologists believe this virus probably will remain, among human beings for a long time.
Now what we see with that pandemic is people being forced into isolation. Isolation and loneliness have been studied, and studies have shown chronically lonely people have genetic manifestations. Genes are turned on, genes are turned off, just from being chronically lonely.
So the commitment of the ministries first is safe school opening. When they reopen, it should be safe and following all sanitation protocols. And the second one, you have to reach the unreached.
After the pandemic, many of government really wanted to try digital-based learning solution, continuous learning solution right away. But usually government doesn't have any system to spend the money for this type of R&D or development.
There's a fantastic UNICEF report from 1999 that argues that a crisis response should be seen as a development opportunity. And I think that's very true here. We should be using this moment of investment and focus to build systems and lay the groundwork for a more equitable education system when COVID starts, the curve starts flattening, and hopefully there'll be a post-COVID reality.
What the world has witnessed during the pandemic is not so much an indictment of globalization, but a reaffirmation of interdependence among the nations and peoples of the world.
At some point, years from now, some student of epidemiology, economics, and statistics will run a regression. And they will look at the world and they will say, look at these countries that were called autocracies. Look at these countries that are called Western-style liberal democracies. Correlate that with the number of deaths, the rate of infection across these societies. And they will say, how does this compare to what is supposed to happen?
So as Danny said in the video, what is supposed to happen? So that brings us to the theme of today's webinar, which is on the road to recovery. Some may say that it's a little bit early because, as we all know, the pandemic is still unfolding in many parts of the world. Nevertheless, I think we all should be discussing the road to recovery. How is it that we are going to eventually end up with a correct balance between saving lives, ensuring economic survival, as well as maintaining social equilibrium. A lot of people will say that there's still a lot that we don't know. For example, why is it that some people get very sick and some people don't get sick at all? What will happen when schools reopen? And there are still many, many unknowns. But what I'd like to say is that we also do know some things, and from the experience of the past few months. For example, we know that masks work very well in reducing the transmission. We now know that there are some treatments which are useful for severe cases of COVID-19. And we also know who is at risk. So that's sort of the setting for today's webinar, talking about on sort of the road to recovery. So that's really all I'm going to say by way of introduction. I'm going to begin by introducing myself. My name is Tikki Pang. I'm a visiting professor at the Yong School of Medicine at the National University of Singapore. Previous to that, I was a visiting professor at the Lee Kuan Yew School of Public Policy. And before that, I was at the World Health Organization for 13 years as Director of Research, Policy, and Cooperation. I'm moderating today's webinar from Geneva in Switzerland, and it's 4 o'clock in the morning here. I'm very grateful to my other panelists in different parts of the world, showing you how global this webinar is today. So let me introduce Dr. Mari Pangestu. Hello, Mari. Who is the Managing Director for Development Policy and Partnerships at the World Bank in Washington, D.C. So, Mari, it's what time is it there for you? 10 o'clock at night?
10 p.m.
10 p.m., yeah. So Mari's been at the bank since March of this year, but previous to that, she was Indonesia's Minister of Trade, as well as Minister of Tourism and Creative Economy. So we would be very interested in hearing her views on the road to recovery. We then have Professor Adeeba Kamarulzaman. Hi, Adeeba.
Hi, Tikki.
Adeeba is doing this from Kuala Lumpur in Malaysia, which is probably 10 o'clock in the morning. Adeeba is Dean of the Faculty of Medicine at the University of Malaya, where I spent 22 years of my life in a previous existence. Adeeba has also, since July of this year, been elected as the president of the International AIDS Society, or probably the biggest organization in HIV/AIDS, and I believe the first Asian to hold that prestigious position. So good to see you and looking forward to your insight. And last but not least, to welcome my previous boss, Professor Kishore Mahbubani, who is, hi Kishore, who is at the moment a distinguished fellow at the Asia Research Institute at the National University of Singapore, a very distinguished career in the Foreign Service. Kishore was Singapore ambassador to the United Nations, president of the UN Security Council, as well as a permanent secretary of the Security Council. Permanent secretary of the Minister of Foreign Affairs. So very much looking forward to hear Kishore's views. Okay, so let us get going. We will begin with Mari to sort of maybe walk us through the reality that the road to recovery is not going to be straightforward, linear, and it's going to be very complex, and it'll probably involve several stages along that road. So she will begin by telling us a little bit about perhaps the different stages of the road to recovery, and then set the context for the other speakers. So over to you, Mari.
Yes, thank you, Tikki.
I'd like to thank the HEAD Foundation for inviting me to this webinar. Congratulations from the video. It looks like you've had very interesting discussions preceding this. And to start where Danny left off, what's next, as Tikki said. The topic today is how we can future-proof the road to recovery from the COVID-19 pandemic. And I was asked to kind of set the scene. And if you could pull up the slides and go to the next slide, please. Let me just start with what's at stake. The sober facts, if you like, as to how COVID-19 is massively derailing the 2030 SDG agenda and disrupting the lives of billions of lives and livelihoods. We know that over 150 countries are projected to experience negative growth in 2020. And you can have deeper contractions, of course, depending on how long the lockdown lasts. And we also expect that 80% of the world's informal economy workers will be affected. And 73 more million people will be living in extreme poverty. The numbers could be higher depending on the various scenarios. And what is important, especially for the World Bank Group, whose vision is to reduce and eliminate poverty, this is the first rise in poverty since 1998. So this is really the stakes are really, really high for us to really work together on how we can future-proof the road to recovery. And not only do we have the impact of the lives of billions, the risk of increasing inequality is also the other a very important issue that we are facing because the impact and the ability to adjust is uneven across sectors, occupations, and countries, and as well as across the more vulnerable groups in society. They are the ones who are least able to cope with this pandemic, with the impact of jobs and so on. And I just want to focus on one particular group, which is women, because the sectors that are most affected and the fact that they have to stay home to take care of children because of school closures means that the impact on women is much higher. And they're also experiencing specific risks such as gender-based violence and reduced health services delivery as everything focuses on the pandemic. How then should countries and international cooperation? I think there was a statement in the video about how we need to really work together on this to respond and prevent the setback on decades of development gains. And how do we go on to what's next, which is the future and the road to recovery. And as one of the statements from the video said, how can we take this opportunity to actually rebuild better? And that's really what we hope we can try to explain in the slides that I'm going to present to you. And in order to help our discussion today, let me share with you a framework that the World Bank has tried to develop that really firstly focuses on the 3 stages of how we get to the recovery, which is, first of all, you have the relief of the emergency response to the health crisis and the immediate social and economic impact. And then you have the restructuring part, assuming that you start opening up. You have to restructure your health systems, your firms, and restore your human capital. Then you get to the recovery stage, which really entails taking advantage of the new opportunities to build back better. But, you know, it's, as Tikki said, you can be opening up and then you can have a second wave, then you end up locking down. So these stages go back and forth, and you can be if you don't do things right, you can be in the relief and restructuring stage for some time. And this risk of prolonged emergency period is high if you don't get you don't do the right policies. And then the longer you are in the relief and restructuring stage, the harder it is for you to get on the road of recovery. And so you have the relief, the restructuring, and the recovery. And then it's across 4 key pillars of support, or 4 key elements in the whole country or in the whole society that we need to think of, which is saving people, saving lives, protecting the poor and most vulnerable, and ensuring that firms continue to have their lights on, continue to create jobs, and businesses and the financial sector survive so that you can have a basis for recovery. And finally, the role of policies and institutions and the policy reforms that are needed for you to be able to rebuild back better. So you have 3 stages and 4 elements in a country or in an economy that matters for you to think about how you go on this road to recovery. Maybe it makes it's better if you look at the whole framework, which is on the next slide. It's a very crowded slide, but let me just try to tell you the story of 1 or 2 elements in this slide. So if you take saving lives as the start, you can see that the action that we must do to save lives is really the core public health services, which is obviously about how do we do the testing, the isolation, and the treatment of the infected, the tracing, the quarantining, and border health security, as well as how you coordinate within the country, how you communicate in the country to make sure that you can do a good job of the containment, and providing protective gear and equipment to your health workers, and having the critical care like the hospitals, the ICU, and so on. We have countries in Africa where you only have 4 units of ventilator, for instance, in a whole country of 100 million. So these are some of the dire challenges we face in the field. And to make sure that it's also delivered to all. This is really the challenge, including vulnerable groups. You can think of many vulnerable groups. In some cases, it's migrants or refugees, for instance. In other cases, it's the disabled and so on. And you know, one thing that we have to think about, besides the medical supplies, the supply of water. If you're being asked to wash hands, if there's no water, how can you wash hands? So we are really having to also, in the emergency phase, think about the supply of sanitation and water. And people have lost their incomes if you have lockdown. Children are not going to school. So you really have to also focus on cash transfers, which can be government delivered or community driven, delivered by communities. And you have to go broad and scale up on many fronts, whether it's cash or delivering food or protecting children that are not going to school. The vulnerability of food insecurity is very, very high. We have studies that show the loss of income has already led to many of the countries in Southeast Asia, included, that they are reducing what they're eating by about 25%. So you're already having, I suppose, impact on human capital. So that's why focusing in the relief as well as in the restructuring stage, for instance, to make sure that people are eating, especially children. Otherwise, in your recovery, you are going to have a deficiency in the human capital, for instance. So I'm just giving you examples of how the stages are related. So going back to the saving lives, and I'm focusing on the health system. There are many aspects to this, but let's just focus on the health system. In the restructuring phase, as you start opening up, you need to focus on how do I restructure the national health system for public health preparedness, and also making sure that as everything was focused on COVID in the emergency phase, there are many other health services which are suffering. Which are leading to children not being immunized, women not getting health services, and not infectious diseases such as HIV, AIDS, and TB not being taken care of. And you know, you're going to have more deaths and more health problems and more human capital destruction if you don't take care of that. And then you have in this restructuring phase, which I guess some of countries are already in, it's the issue of vaccines, the production of vaccines, some optimism that the vaccine can be found, how to have the alliance in production, aid of the vaccine companies are supposedly cooperating so that you can share the licensing and produce in sufficient amounts at affordable prices, especially for developing countries. And this is where you need global cooperation. And then in the final stage, in the recovery, how do you use the opportunity to build back health systems for core health services and pandemic preparedness, and hopefully have permanent behavior changes? And how do you build one health and food safety systems? We know that the pandemic started with the interaction between animal and humans. How do we prevent future pandemics and infectious diseases? This is a national issue as well as a regional and international cooperation issue. So I'm just showing you a way of looking at this. We can talk more about the business sector and the investment and so on. But because I was asked to look at one particular issue which is important for Southeast Asia and East Asia, which is the impact on trade and investment. Let me just focus on the trade and investment story, both in the current stage as well as in the recovery stage. COVID-19 is impacting trade, as we know. It disrupted supply chains in a big way. And this picture shows you that the global shock and the crisis, the pandemic, hit the vital global nodes simultaneously. 17 countries with the highest COVID cases are the critical nodes in the global trade network, including China, the US, and Germany. And the slide on the right shows you that economic activity has become more synchronized since the mid-1990s. So it shows you how reliant global economy and societies are on supply chains. And the total lockdown and the drop in global demand has really led to global disruption in trade and GVCs. And East Asia and Southeast Asia relies a lot on trade. So, we are really worried now that the vulnerabilities revealed by the pandemic will also risk fragmentation and retreat from global value chains, because countries are now worried about reducing their reliance and dependence on certain suppliers, wanting to also keep the medical supplies and the food supplies domestically and so on. This shows you that for the 4 major trading blocs, US, China, EU, and Japan, they reached the lowest level of trade with almost 25% of contraction of imports. And it's mainly intermediate goods that fell, which is really the driver of the global value chains. And activities, many of these activities cannot be carried out online as you would think in the response of COVID. And if only one part of the global value chain is missing, you cannot complete your production. This was experienced during SARS, the floods in Thailand, and the Fukushima disaster. And this pandemic is showing you in a big way how the disruption can happen. How is COVID-19 affecting supply chains and value chains? Really, firms are trying to adjust. They have risk management strategies. They try to stockpile. They try to find other suppliers. And some are able to repurpose, like garment companies making PPE clothing and so on. But what the pandemic is showing is that really firms are having to rethink. They were already rethinking about diversification and relocation because of the US-China trade war or trade tensions. But now they are even being asked, what do I do now with all the uncertainties? What is going to happen is going to be a balance between efficiency and resilience, because you want to be efficient, pick the most cheapest location to produce your goods, but at the same time, you don't want to risk relying on certain suppliers that can be hit just like in the pandemic. So what you may end up doing is increasing resilience by keeping more inventories, which would be costly, diversifying your suppliers, which can be costly if you have to have customization and standards, and inefficient if there are scale economies, but that's what will happen and probably would lead to rising costs. But this is what will probably happen. And what we hope doesn't happen is that government intervention, trying to reshore companies back to their home countries, because this is going to be leading to inefficiencies and will affect the openness and predictability of trade and global value chains. Some countries like Japan are providing subsidies for reshoring. The US is also providing incentives for countries to reshore. And this can really spiral out of control and undermine openness and predictability, which has been the mainstay for Southeast Asia and East Asia. So this is something to watch out for. I think it's still early days. We are waiting to see what happens. There are some positive signs that trade is improving. Companies are, I think, still wait and see. They are delaying or canceling investments. They're not changing too much their strategy, but they are diversifying and relocating, which we already have seen prior to the COVID. What the final message I would say is that countries that want to be part of this reconfigured global value chain need to be attractive, and therefore that is about improving their investment climate. And it is incumbent for us on the international cooperation side to keep the openness of trade and investment flows to happen, whether at the regional front with ASEAN and RCEP or globally, so that we don't have restrictive trade policies prevent us from going on this road to recovery. Readjustments and diversification will happen. It's not easy to de-link and rebuild these very complex global value chains, but some adjustments will happen. But it can be destroyed if we go down the road of protectionism and inward looking, and the international or regional cooperation does not help us in keeping the trade and investment climate to be open. So that would be just my main message on the road to recovery on the trade side. I'll end there. I probably exceeded a little bit my 15 minutes. Apologies for that, but I hope that I was able to provide the scene for the next speakers. Thank you.
Thank you very much, Mari, for that very lucid introduction into the various stages of recovery. I think what I took away from there is your emphasis on how important COVID pandemic has highlighted inequalities across all the different pillars that you talked about. Also, the fact that it's important for health systems not to neglect other areas. That is probably a nice segue, both inequality and the need to take care of other areas of health into what Adeeba is going to say. Adeeba has tremendous experience in dealing with a pandemic. Adeeba, correct me if I'm wrong, but a pandemic which is still ongoing. I think a lot of people have this view that HIV/AIDS is history. I don't believe it is. So, you know, it would be very nice to hear from you in terms of your past experiences. There's something that we can learn from the HIV/AIDS pandemic that would be valuable on this road to recovery with COVID. So over to you, Adeeba.
Thank you very much, Tikki, and thank you very much for inviting me to be on this panel with such other illustrious speakers. Yes, you're right. The HIV pandemic is far from over, although, you know, the global aim is to see the end of AIDS by 2030. And certainly in the last 4 decades from, you know, the response to HIV, but it's certainly far from over. And likewise with the COVID-19, although there's much optimism with the vaccine, and I guess a number of people believe that you know, we're not going to see the vaccine in September, or at least not until next year. So what do we do in the meantime? I think preparing, as Mari so eloquently put just then, for the long haul is what we need to do. And to do that, I think there are lots of lessons we can learn from the HIV pandemic. You know, the global response that has managed to turn what once was, in the early 80s, a disease that was a certain death, to one that can now be managed, you know, as a chronic disease. And we have learned a number of things. So in my presentation, in the next 10-15 minutes or so, I'm going to use a few well-known mantras, a few principles in the HIV response that I think we could learn from as we move forward and learn to also live with the COVID-19 in the recovery phase that we are going to live with in the next few years. The first of which is what we in the HIV world often call know your epidemic, know your response. So we have seen in the COVID-19 pandemic certainly that that there's an amazing heterogeneity in the burden and mortality across the globe. Of course, there are many reasons for this. How quickly government responds, how extensively the response is, and what type of response. And there's suggestions even maybe the climate might play a role. But nonetheless, I think for individual countries, it's extremely important to understand your epidemic, where the infections are coming from, where they are at, would then allow you to respond accordingly and not perhaps return to the early phases of the epidemic when most nations employed, necessarily I guess at that time, nationwide lockdown. And that certainly was the needed response at that time. But perhaps as we move forward and we know much more, the science around COVID-19, we could employ a much more nuanced response that responds to the geographic needs, that responds to the risk group needs. And to be able to do this, it's crucially important that we have data, that we, meaning countries and regions, have real-time data that they could respond to. And this means having an adequate surveillance system and data that's disaggregated by regions and infections and death rates, which will allow individual public health authorities to then employ what is necessary. So this is in the context of HIV, for instance, the difference between the epidemic in sub-Saharan Africa, which in the past has largely been a much more generalized epidemic, versus the epidemic in Asia, where it's much more within the vulnerable and what we call key populations. So you kind of target your response accordingly, and I think learning from that, that is how we should move now in terms of responding with the public health response with COVID-19. The second principle with the HIV response has been that there is no one single magic bullet. We have stressed on the importance of testing, we have stressed obviously on the importance of treatment, and now increasingly on pre-exposure prophylaxis and adherence to treatment. Likewise, the response to the HIV epidemic, despite all these biomedical tools that we now have, is not going to succeed if you don't ensure that there are also behavioral interventions that are crucial. We've had condoms for decades, but unless you have the behavioral interventions, excuse me, to ensure that condoms are utilized, you're not going to have a high rate of condom usage. So similarly, the much needed behavioral interventions in COVID-19, the masks that have been shown to be extremely effective, the hand hygiene, the physical distancing, the shelter in place, and avoiding mass gatherings. Now, how do you ensure the behavioral interventions that's needed to ensure that people adhere to these simple yet and simple and inexpensive interventions, yet we're seeing reports of it being flouted everywhere. So masks not being used, and I think just yesterday there was a report in the Economist where there was a massive pool party in Wuhan, of all places, where there's been a a severe epidemic, and yet now we're seeing people having large parties and without masks. So how do we ensure that the compliance and the adherence to these much needed, simple and effective, inexpensive interventions continue for the next few years? We human beings, I think, are getting tired of being locked down and are naturally seeking for a social life. That's just a natural way we all are, and so ensuring that is going to be extremely important, but difficult, as we also learn from the HIV epidemic. So we do need to fall back in many ways on the biomedical interventions, and although much of the excitement has been around the vaccine, and rightly so, the unprecedented advances in development of vaccine in such a short period, and we're all naturally waiting with bated breath the kind of front runners in vaccine development to eventually come to human trials and large human trials and subsequently into use. But I think as we wait for that, the other key biomedical intervention is, of course, testing. Again, a key intervention in the HIV epidemic. The 90-90-90 goals speak to this. We want 90% of people who are HIV infected to be tested and to know they're HIV tested and their HIV status. And likewise, I think in the COVID-19 epidemic, the sooner people know that they are COVID-19 or SARS-CoV-2 positive, the better, so that they can isolate themselves. Contact tracing can be done and quarantine enacted. But thus far, I think the traditional RT-PCR has been not the most simple test to use. You still require large labs and so forth. So fortunately, there are many institutions now who are coming forward, and again, the race is for an inexpensive, simple to use, hopefully point of care test of the SARS-CoV-2 tests that will be also inexpensive and be widely available soon. And I think yesterday the Oxford group announced their RT LAMP PCR, the RT LAMP RNA test that hopefully will be commercialized and be widely available soon. And there are many other companies that are doing this. So with that point of care testing, hopefully we could also then introduce home-based testing, which is also another innovation within the HIV world, and also the cervical cancer world, that will allow people to know their status and then take precautions, whether to stay away from work, whether to stay away from travel if they are COVID-19 or SARS-CoV-2 positive, even if they do not have symptoms. So I think hopefully this technology will come in soon and will allow us to respond a lot more effectively as we wait for the vaccine. However, behavioral interventions and biomedical interventions alone, again, are not going to be enough. There is a third major intervention that perhaps not so simple to do, but will require governments and multilateral institutions to seriously think about it. And I think Mari kind of spoke to this as well. And there certainly needs to be action on the social, economic, political, and legal factors that currently undermine people from taking these effective prevention measures. And which brings me to the third important principle and mantra in HIV, but also, of course, in the SDGs, which is leaving no one behind. And if there's one thing that both the HIV pandemic and the COVID-19 pandemic have brought to the fore is the impact of inequality and in how severe people who are already marginalized and vulnerable are impacted by both these diseases. In the case of HIV, you've got people who inject drugs, you've got the LGBT communities, sex workers, and others who are, most at risk from HIV. In COVID-19, you have the essential workers, the migrants, migrant population, prisoners, the elderly in nursing homes form a large part of this vulnerable population. So when one responds to them, when one protects them as we move into the recovery phase, just like in the HIV pandemic, where focus needs to be given to those who are most at risk. Likewise, these vulnerable population within the COVID pandemic deserves the same kinds of response. And what we mean by that, for instance, with prisoners and migrant workers. So let's start with migrant workers first. Invoking the immigration laws and putting them in detention centers is not going to be the answer to ensuring that the migrant population, where the risk is higher because of their living standards and the crowded living areas that they unfortunately find themselves in. So unfortunately, the tendencies for governments to look for them, and those who are undocumented are placed in detention centers. Well, that's just a recipe for increasing the risk of infection. So in terms of leaving no one behind, what is required is actually education and meaningful engagement with these communities, giving them education in language that they understand in a socially and culturally meaningful and acceptable way is going to be a much more effective approach than the criminalization of undocumented migrants. It's just one example. Prisoners also suffer the same risk because of crowding. How do you ensure good hygiene, whether it's hand hygiene or just general personal hygiene? Ventilation. Now more and more the science around the importance of ventilation in COVID-19 is being understood. It's an airborne disease or not is being currently debated. Well, we know that prisons, the risk for TB in prisons high. Why? Because of the overcrowding and the poor ventilation. So likewise, what you're going to see in prisons is in terms of COVID-19, and there have been many reports of clusters and outbreaks in prisons with COVID-19. Several countries have adopted decarceration measures where people who have minor infringements with the laws are, instead of being imprisoned are, the change to fines or other matters or other ways of punishment. A third vulnerable population that also requires special attention are the elderlies in nursing homes. Again, we've seen many outbreaks and unfortunately levels of mortalities, particularly in Europe and also in the US and UK, related to nursing homes. So special attention needs to be given into nursing homes. Whilst we focus during the early phases of the epidemic, ensuring that healthcare workers in acute hospitals have adequate supplies of PPEs and hand sanitizers, etc. In nursing homes, those essential equipment perhaps were forgotten until outbreaks were recorded in those places. So in terms of the mantra of leaving no one behind, and these are just some examples of special and focused response to these highly vulnerable groups need to be continued as we move forward in our road to recovery. Otherwise, we will continue to have a vicious cycle of infection and will not be able to break the chain of transmission if we just solely focus on the acute care hospitals and communities, whereas these places which may be hidden, such as the migrant population, the prisons and the nursing homes are the ones where particular risks can be found. And finally, in terms of leaving no one behind, I think Mari touched on this as well. So we move to the next slide. Thank you. Is the importance of not just leaving no one behind, but leaving no other, people with other risk, with other diseases behind. And we certainly saw this very early in the epidemic when in the acute hospitals like mine, where outpatients needed to be closed, elective surgeries needed to be stopped in order to have operating theaters and intensive cares ready for COVID-19 patients. Well, that, and again, we've seen reports of increased and delayed presentation from other diseases such as cancer, which then leads to increased morbidity and mortality in patients with other diseases. So as we move forward, health systems will need to continue to be vigilant and to be prepared for management of COVID-19 with all of the preparations such as PPEs and segregation of patients, whether it's in the emergency department or in the wards or in OTs, in ICUs, excuse me, but this cannot be at the expense of patients with other diseases. And so you see more and more usage of telemedicine, for instance, to reduce the overcrowding in our patients, telemedicine to screen patients for cases and so forth. So again, in terms of the changes that needs to happen to healthcare systems that Mari alluded to, I think this is going to be essential as, well, even if we manage to bring COVID-19 under control, well, hopefully not, but we always need to be prepared for the next pandemic. And I think HIV has taught us so much, and now COVID-19 is teaching us more in terms of at least the acute hospital and public health preparedness moving forward. The other downside to this, of course, in terms of leaving no one behind, the Global Fund has estimated that the mortality from AIDS, TB, and malaria is at least going to double in the next few years as a result of the COVID-19 pandemic, because of health systems have been overwhelmed, because services have been disrupted, and resources being diverted from these diseases to COVID-19. So all this we need to take into account as we plan the response, not just for COVID-19, but for all the other diseases in the next few years. And finally, I think I'd like to say that the 4 decades of the HIV pandemic has certainly, fortunately, prepared laboratories, prepared us in the scientific world in terms of a quick response to the COVID-19. Hence, in such a short space of time, we've seen, advanced development in vaccine. We've seen advanced development in diagnostics, and the other wonderful thing that we've seen, if something good that has come out from the COVID-19 that's devastated the entire world, is the very high level of collaboration that we're seeing, that's also been instrumental in terms of ensuring that we get these much needed diagnostics and vaccines and therapeutics out, not just into advanced clinical trials, but into patients. And finally, we what we're also hoping to see out of all this is an opportunity for cross-disciplinary research between COVID-19 TB, COVID-19 HIV, and so forth, that can only be supported with improved and increased international solidarity and collaboration. So with that, I thank you for this opportunity to share my thoughts.
Thank you very much, Adeeba, for those wonderful insights. And as you said, HIV has taught us so much. And personally, if I look ahead into the trajectory of HIV/AIDS from an explosive pandemic in the 80s and the 90s to a situation which is, more or less controlled at the moment, you see the importance, as you stressed, of biomedical interventions. For example, the availability of ARTs, the accessibility to it, as well as a very important behavioral changes. And the other similarity is, for both diseases, we are going to still be searching for a vaccine. So perhaps if you project COVID, ahead, perhaps the same kind of scenario will unfold. The virus is not going to go away. So maybe elimination is not a goal, but perhaps management and control. Thank you very much once again for those insights. Before I move on, I'd just like to remind the audience, the people who have registered, to please put up your Q&A into the Q&A facility, and importantly, to also vote on the questions. So that will help us when we get to the Q&A in terms of identifying which are the most important questions. Okay, so please do that if you haven't done so already. I see that there are already quite a few questions in the Q&A. Okay, our final speaker today is Kishore Mahbubani, and both previous speakers have alluded to the importance at the higher sort of global level of cooperation in the social dimension, economic, political dimension, and the importance of multilateralism. And, there's probably no better person to address this very important topic than Kishore. So really, it's a privilege to have you with us, Kishore. So please, you have the floor.
Thank you. Thank you very much, Tikki, for inviting me to this event. And it's such a joy to follow the excellent presentations made by Mari and Adeeba, and I hope that I can compliment them. But as you indicated, I'm going in a very, very different area. I'll use very different analogies. So let me begin by saying that the theme of the discussion is road to recovery. Now, as we all know, before you start a journey on a road, you must have a map. If you don't have a map, you won't know where you're going. And if you want me to summarize what I'm going to say in 1 or 2 lines, it's very simple. The core of the problem that we are facing in dealing with all global challenges, including, sadly, COVID-19, is that we are sailing into the 21st century with mental maps of the 19th and 20th century. And that's the fundamental reason why we're having difficulties handling all these global challenges. And to explain how significantly the 21st century is different from the 19th and 20th century and why we need to change our mental maps, I use what I call a boat analogy. I'm afraid my boat analogy is not going to be as memorable as the one that Adeeba suggested, which is that you must consider our face masks to be our new condoms, because that's how we prevent COVID-19, and I'm going to use it now in all my speeches because I know my male friends are very careful about using condoms, so they will also be equally careful about using their masks from now on. But anyway, going back to my boat analogy, the fundamental transformation in the world that has happened, and we must accept this boat analogy, is that in the past, when there are 7.8 billion people in the world, when 7.8 billion people live in 193 separate countries, it was as though they were living in 193 separate boats. And each boat had a captain or crew, and we had rules to make sure the boats didn't collide. And that was the previous global order. But as we know that, we have gone in the past, 50 or 60 years through the most incredible globalization, and we have now shrunk the world enormously. We live in a very small, densely packed, interconnected, interdependent universe. And so effectively, we now live on the same boat. So the 193 countries are no longer 193 separate boats. They're actually 193 separate cabins on the same boat. And frankly, if you had any doubts at all that we are on the same boat, COVID-19 has removed all the doubts. I mean, it's shocking, right? It's hard to believe it just began in December, January in some place in Wuhan. And guess what? 4 months later, the entire world shut down. The whole world shut down. So we are on the same boat, very clearly. But unfortunately, our mental maps still pretend that we are on different boats. And that's why we're not having the cooperation that we need. So the first thing we need to do, and frankly, I would say, forget the leaders of the world. The leaders of the world are stuck in old mental maps. We need a bottom-up process of people telling their leaders, hey, what's wrong with you guys? Don't you realize the world has changed? Why are you still using 19th and 20th century mental maps? And I can tell you, I'll give you 2 concrete examples of how 19th and 20th century mental maps are preventing the essential cooperation that we need to deal with COVID-19. And these 2 obstacles, number 1 is, of course, the geopolitical dimension. And if there's one thing that is preventing significant global cooperation in dealing with COVID-19, it is the outbreak of the US-China geopolitical contest. And I can tell you this, that both the United States and China are behaving irrationally in putting their geopolitical contests ahead of dealing with COVID-19 because in so doing, they're damaging not just their economies, but their own people. I'm so glad that Mari highlighted the statistics on global poverty. Last night, I was talking to a friend of mine in New York, and she told me that in the US also, 50 million people have gone below the poverty line as a result of COVID-19. So the logical thing for United States and China to do would say, hey, let's put aside our differences and collaborate against a common enemy. And by the way, that's a very old rule of geopolitics. In fact, in World War II, Winston Churchill decided, my number one enemy is Hitler. So what did Churchill do? He flew to Moscow and had dinner with Stalin, whom he disagreed with on everything, but doesn't matter because they had a common enemy, Hitler, so they cooperated. So just as Churchill and Stalin cooperated in World War II against Hitler, what we need to see is United States and China cooperating together against COVID-19, and it would help their people immediately. And just imagine that. Just imagine the US and China announcing, guess what? COVID-19 is more important. Let's set aside our trade war. Let's set aside our differences. Let's remove our trade tariffs. Let's cooperate. Let's collaborate on developing a vaccine. Can you imagine how much happier the world would become if United States and China just did this simple, commonsensical thing? But it's amazing. These two great powers cannot do what is commonsensical. Why not? And that's why it's important to understand the geopolitical forces driving our world, because they're preventing essential global cooperation. And that's what Tikki, my book is about. I deliberately put it behind my shoulder as China won, so that, because you have to understand the deeper structural forces that are preventing commonsensical cooperation between these two great powers. Now, obviously, I don't have the time in my 15 minutes to explain it all, but let me just mention quickly 3 structural forces, but they're all elaborated a great deal in the book. The first structural force that's driving this geopolitical contest is number 1, and this is a 2,000-year rule. Right? Remember, everything I'm saying is thousands of years old. So whenever the world's number 1 emerging power, which today is China, is about to overtake the world's number 1 power, the world's number 1 power always pushes down the world's number 1 emerging power. And Graham Allison, the Harvard professor, has written a book called Destined for War that describes this very well. And I also describe that in my book. So the United States thinks this is the last chance we have to push China down, and that's more important than dealing with COVID-19. And that's why there's no collaboration. The second structural force is one. The first one, everybody talks about. The second one, nobody talks about. Why does anybody talk about it? Because it's politically incorrect to talk about it. And what is this politically incorrect structural force? There's always been in the Western psyche, going back centuries, from the time when the Mongols almost overtook Europe, a fear of the yellow peril. And I want to emphasize this emotional, irrational dimension, because that's why you don't get common sense cooperation, because of emotional factors that are preventing rational collaboration. And if you look back and you ask yourself, why is the Trump administration going against all scientific practice, insisting, instead of calling it COVID-19 or the China virus, the Wuhan virus, that triggers up images of the yellow peril. That triggers up support for what they're doing. And so they can say, you see, we're standing up to this. So that's yellow peril dimension. We must surface it and deal with it and get rid of it, and then we can get rational cooperation. And the third structural force that is driving this geopolitical contest, and which explains why in the United States today has never been as divided as it is today. In fact, it may be on the brink of a civil war if something goes wrong in the elections in the United States. But yet in this highly divided, highly polarized United States, there's total unanimity almost. It's time for the United States to take on China. Why? Because on both sides, Republicans and Democrats, there's been a deep disappointment that they thought that if the United States engaged China, if the United States opened up China economically, China would then open up politically, then China would become a liberal democracy like United States, and China, United States could live happily ever after. And as you know, China hasn't become a democracy, and nowhere close to becoming a democracy. So there's a bipartisan disappointment with China. But as I quickly mentioned in passing, future historians will scratch their heads and say, what is this? How did this young republic, United States, less than 250 years old, less than 250 years old, think it can transform a civilization that is 4,000 years and make it to its liking? Now, again, it's important to bear this deep, strong historical background to understand how difficult it will be to solve this geopolitical contest. So that is the one major structural obstacle to collaboration on COVID-19, and the structural obstacle is driven by powerful forces. And the second one is also geopolitical. And this is that the West, which has been dominant for 200 years in the 19th and 20th century, is getting aware that it is losing its dominance. And it will naturally lose its dominance because from the year 1 to the year 1820, the two largest economies were always those of China and India. We're seeing the natural return of China and India, and the West will become less important. But the West wants to cling on to power, wants to cling on to the privileges it had in the global system. And so what it does is that it tries, sadly, to weaken multilateral institutions that could in any way constrain Western power. Now, let me emphasize that this is primarily driven by the United States, but Europe has been sadly a complicit partner of the United States in this. And the Exhibit A is the World Health Organization. As you know, Tikki, all this I've documented in my book, The Great Convergence, and I quote your friend, Kelly Lee, in my book, The Great Convergence. In the 70s, I think about 62% of the budget of the World Health Organization came from compulsory assessed contributions. You can make long-term planning on that basis. And 20% or so came from voluntary contributions. Today, the ratio has changed. Only 18% comes from compulsory assessed contributions. The rest comes from voluntary contributions. The WHO cannot make long-term plans on the basis of voluntary contributions. It cannot develop inspectors and so on and so forth. So sadly, the West has been weakening the World Health Organization. And that's why the World Health Organization has had challenges dealing with COVID-19, because this is a result of a conscious effort on the part of the West. So clearly the time has come for the West to change course. But today, as you can see, common sense would tell us we must come together to strengthen the World Health Organization. What did the United States do? The United States left the World Health Organization. And as Richard Horton of the Lancet said, that's actually a crime against humanity, because you're crippling the ability of the World Health Organization to help the really poor countries in the world who really need the help from COVID-19. Why did this happen? Another geopolitical obstacle. So I emphasize all this. So now that I've depressed all of you, let me end with some piece of good news. Is there a way out? Is there some way we can, in a sense, transcend these two geopolitical obstacles that I've spoken about, the US-China geopolitical contest and the Western's effort to weaken multilateral organizations? And my answer is yes, there is. But the first thing is that the Asians must lead the way in putting 21st century mental maps in their minds. And they can do it with two simple steps. Step A, get rid of the idea that the solution somehow will come from the West. That used to be the case. The Western societies outperform other societies. They're the best universities, best think tanks, best everything in the world. But clearly something has gone wrong in the West. And frankly, if I can put it very bluntly, many Asian minds remain colonized. They cannot believe that we can provide the solution. They have to provide the solution. But actually, we have to provide the solution. And the second step, by the way, at a time when the many major countries, sadly, especially the United States, they're closing their borders to trade, to free trade agreements, we must persist. And I want to strongly endorse a point that Mari made at her presentation when she said we must work to strengthen RCEP, Regional Comprehensive Economic Partnership, and strengthen collaboration within ASEAN. And by the way, the one piece of good news I can share with the audience is that when COVID-19 broke out, obviously countries in ASEAN also closed their borders to human travel. They had to, they have no choice. But the good news is that they did not close their borders to trade. And we continued trading with each other. We continued supplying vegetables and eggs and meat to each other. That's very critical. And we continued with that. And today, frankly, what the world needs to have, if you want a beacon, right? If you want someone to light a candle and show the way out of the darkness that COVID-19 has created, that candle can be lit by Asia, by the Asian countries continuing to open up and trade with each other, continuing with RCEP, because that at the end of the day is going to stimulate a recovery. And here we are very, very fortunate. By a remarkable accident, the first major economy that will come out of this COVID-19 recession, and it is coming out of the COVID-19 recession, is China. And you know, it's important to bear in mind that if you look at the Western perceptions of China, oh, it's a rigid communist party state, it can never adjust, it can never do well, versus the reality of China, which I describe in my book, that China today has one of the most meritocratic governments in the world. And the reason why the Chinese economy is the first to bounce back is because they have developed, in a sense, several institutions of good governance that are working together in collaboration, pushing down the COVID-19 outbreaks, opening up the economy. And today, frankly, if you go to Shanghai, I mean, Adeeba mentioned the picture of the Chinese in the pool in Wuhan, which frankly shocked me also, Adeeba, and I thought that wasn't very wise either. But at the same time, if you go to Shanghai and you try and book a table at a good restaurant, not fully booked, amazingly, Shanghai is back to normal. It's the only major city that has gone so far back to pre-COVID-19 levels. That's amazing. So that shows the way that we in Asia can lead the way. And I think if we did so, if we continue to open up, continue to strengthen ASEAN collaboration, continue to work on the RCEP, and by the way, here, if I, as an aside, let me mention, we should also work hard to bring India back into the RCEP. It's sad that India has left it, because India, as you know, I'm just going to, as an aside, say this, has decided to move closer to the United States for geopolitical reasons. I fully understand that. But the United States today cannot afford to be generous to India, to put it simply. You know, as you know, Trump has canceled H-1B visas. There's no way the United States can sign a free trade agreement with India because the political environment in the United States is opposed to free trade agreements. So if India is looking for a path to growth, rapid economic growth, it's got to come back to East Asia. So this is why it's very important for the East Asian countries to continue opening up their borders, continue trading with each other, because that is the candle that we can light for the world in this darkness of COVID-19. Thank you very much.
Thank you very much, Kishore, for an always wonderful and lucid insights into how global cooperation is at risk because of the superpower clashes that's going on, and for underlining that multilateralism is still sort of the way forward. I think getting an insight from your perspective is very helpful in terms of complementing what Mari and Adeeba had to say earlier. Okay, so I think one of the features of the previous webinars is the quality and the depth of the questions that we have received from the audience so far. So rather than, I do have a set of questions prepared to ask individually to the three of you, but looking at the questions that are coming in here, I'd rather focus on some of these questions to sort of maximize the time that we have left for the webinar. So let me just dive straight into this. And as I told you, a nice feature is that the questions posted have also been voted upon. So it is sort of, I'm going down the list of the highly voted questions. And let me begin with Mari, okay? This goes into something that is come up very, very recently. And that is, of course, the question of vaccine nationalism, okay? And the question from Edward Lau is that, developing countries may be disadvantaged in the future because the wealthy and powerful countries have sort of consolidated therapeutics, equipment, and of course vaccines by pre-ordering, sort of jumping ahead and say, we're going to pre-order, we're going to take care of our own citizens. So the question to you, Mari, is how would the World Bank help to mitigate and resolve this development? This, of course, gets to the heart of the theme of inequality. So you want to try and answer that?
Yes. We are actually, this is an instance where there's a potential where global alliance, global partnership potentially can be working. Europe, along with a number of foundations and also the World Bank and WHO included in there, they created this alliance for accelerating the production and research around vaccines and therapeutics. And the idea being that out of the 250 potential candidates, I think there are about 15 who have joined this alliance, whereby they've agreed that whoever comes up with the effective vaccine will share it with others and allow for generic production. And they've created this, what they call the COVAX facility under Gavi, which is one of the alliance NGOs. It's a nonprofit that tries to procure vaccines. It did it for pneumococcal, it did it for other vaccines, but this time focusing on COVID, to make sure that the poorest countries can get access. So we are working together with all these alliances to ensure that there is funding for the research and development, and then there's also funding coming out for the investments for these manufacturing facilities, including in developing countries like India. And the COVAX facility actually has already secured about 300 million doses, I think, from two of the companies, assuming that they are going to be the effective one. And they have spread the risk over a number of other vaccines. And the idea is that these pharmaceutical companies will provide the vaccine at a much lower price to the developing countries and the poorest countries compared to the advanced countries. So it's what they call the tiered pricing. And for the very poorest countries, you would want to be able to provide it to them with grant. Yeah, and the World Bank, because we do operate in what we call the poorest countries, or our IDA countries, we would be able to provide grants for the very poorest countries and loans to the middle income countries who need it to purchase the vaccines, assuming two things. One, that you have enough supplies, and having enough supplies is going to be a big question. You may be able to have enough supplies for the most, what they call the 3% most at-risk population, which is the health workers and the elderly population. So I think what will happen is you have to do it in stages, and then you do the next 20% of the population, because I don't think you are going to be able to produce in enough quantity. So it would have to be in stages, but at least we have the provision for the lending. And the second part of the thing goes to Professor Adeeba's point. Having the vaccine is not a magic bullet, and it's not going to solve everything, right? Because the vaccine, you have to have the vaccination, and then you have to do all the other things like behavioral changes, because it's not going to go away. And vaccination means that you have to have the cold storage facilities. You have to have the health workers being trained to deliver the vaccines. You have to have the delivery and implementation systems in place. You have to have behavior changes for people to want to take the vaccine, and so on and so forth. And this also needs funding. So the World Bank is focusing not just on the procurement of the vaccine and the financing of it, but also how do you actually do the delivery in country. So it has to be this comprehensive program. And we are focusing very much on the poorest countries, because some of the middle income countries can afford to pay for it, assuming you have this tiered pricing. The final thing I would say is that the World Bank has a private sector arm called the IFC. And in fact, they are already investing in a number of companies, including in India, to produce these vaccines. Because another way to secure supply instead of pre-buying is to actually invest in the production facility, and therefore have the right for commitment of some of the supplies.
Okay, thank you very much, Mary. I think you've underscored some of the previous speakers. I think certainly what Kishore mentioned about the continued importance of multilateral organizations. In this case, obviously the World Bank, together with WHO, plus a lot of the other global health initiatives, are going to be central to ensure the equitable distribution when the vaccine becomes available. You also, I think, raise a very important point is, yes, you can develop a vaccine. How do you make sure that people will actually take it, okay? And here, the other big challenge that we are facing is this worrying movement called vaccine hesitancy, okay? The sort of decreased confidence amongst parents, amongst adults even, to accept vaccination as an important public health strategy. That's going to be another barrier, and that vaccine hesitancy is right across the world, in developed as well as developing countries. Okay, so thank you for that. The next question from Fadli Ismail is addressed to Adeeba. The question is specific to Malaysia, but I'm fairly sure it applies equally to all other countries. So this is the question. Prof. Adeeba, you mentioned about the importance of behavior change in handling the pandemic. However, we are seeing signs of caution fatigue among the community in Malaysia. Can you suggest ways to minimize this fatigue among the community, drawing from your experience in handling behavioral issues in tackling HIV/AIDS? So gets to the heart of what you highlighted as the importance of behavior change. So over to you.
Yeah, okay, so thank you, Tikki. Unfortunately, there's not going to be an easy answer to this. I think otherwise we would have had better control of the HIV pandemic in 4 decades. Behavioral change and stigma have been our Achilles heel. So with respect to COVID-19, I think we have no choice but to continue with the communication messages, and I think it has to be consistent and provide the most relevant and up-to-date information. The other problem that we're facing with COVID-19 is the massive misinformation around it. So, and when you get these mixed messages, the community then, finds it difficult to adhere to a given rule or need. So providing, I think, consistent, relevant, and up-to-date message in language that's understandable and relatable. We cannot underestimate in terms of peer messaging as well. And like what I said earlier, for instance, with the migrant communities, we need to provide information in multiple languages, in culturally sensitive ways. And the other is in terms of ensuring these behaviors continue, is, I guess, as the science improves, as we get to know, as we understand the way the virus behaves, and as testing improves, there may be an opportunity to pull back a bit on some of the more severe restrictions that we put in place. But I guess there's no substitute to, in the first place, for countries where the epidemic is still not under control, to bring it under control. And only then can you loosen up a little bit in terms of the more restrictive measures that need to be in place.
Okay, thank you very much, Adeeba, for that explanation. I think what you said reminded me of what Vivian Balakrishnan, Singapore Minister for Foreign Affairs, said, that the three key approaches to road to recovery is, first, a good quality healthcare system, secondly, good governance, and thirdly, social capital. Having a socially responsible population which will adhere to those various behavioral strategies like social distancing, like wearing masks. And as you said, that really focuses on the issue of communication, raising awareness, and sort of the more difficult task of having the communities putting the interests of the community ahead of the interests of the individual. Okay, just something that I picked up from Dr. Balakrishnan. Okay, so thank you for that. The next question from Ronnie Tan, which has got a lot of votes here, is directed at Kishore. And I think this is something that I would guess many of us would like to ask you, Kishore. And it's a very short question, and it goes along the following lines. Will a Biden administration be ready to refresh the outdated map and share the world stage with China? So, Kishore, over to you.
It's a very short question, but very difficult question. But I'll take my stab at it. Of course, you can't predict exactly what they'll behave, but I would say it would be two parts to it. Number one, the US-China geopolitical contest will continue. Whether it's Trump or Biden, it makes no difference, because it's driven by as I say, it's driven by deep geopolitical forces. And no number one power ever cedes its number one position voluntarily. And Biden cannot be seen to be a weak leader in the face of China. And I can tell you, when the debates start between Trump and Biden, I guarantee you that Biden will say, I'm going to be tougher than Trump on China. So that you're going to expect. But at the same time, I also predict that number one, the tone will be very different. Sadly, it's very sad that the Trump administration is engaged in some cases unnecessary insults against China. And I can tell you that George Kennan, a famous American strategist, actually advised the United States when the Cold War, they don't insult the Soviet Union, we still got to work with them at some point. So a lot of these insults, the China virus, the Wuhan virus, I think that would stop for sure. And at the same time, I expect the Biden administration in some ways to be more rational. And so where there can be win-win cooperation between US and China, like for example, win-win cooperation between US and China to develop a vaccine, for example, I think a Biden administration would be more willing to do that if it's going to help the poor people in the United States. So it'll be a kind of a sense that I'm sorry I cannot give a simple answer, but I must emphasize that the world that is coming is very complex. And so you will see on the one hand the continuation of the geopolitical contest, but it will be managed differently and hopefully more rationally. And that's the only piece of good news I can give.
Thank you very much, Kishore, for giving us your considered view on what might happen after the November elections. I'm going to circle back to Mari. And this question comes from Satrio Tanujoyo from Indonesia. Dr. Mari, you mentioned that Indonesian GDP will contract deeper than expected at 5.2%. And as you mentioned, this will result in more poverty for Indonesia and many other developing countries. The impact, especially on children, as we know, Indonesia has a big problem with stunting among children, is really worrying, the impact on children. So the question is there any program in the World Bank to help address this challenge, especially to assist developing countries? Impact on poverty, especially impact on children. Over to you.
Yes, we are very much focused on the impact on children, just because you are talking about a lost generation otherwise, and the human capital cost is going to be really high, and it's going to affect your road to recovery and affect your the future potential for growth. So it's very important to focus on children, and you can start with making sure that it's the education as well as the health aspect and the nutrition aspect. So you have to make sure that when you do the social assistance programs, that they somehow have to have built in particular attention to making sure that children are also getting food and getting the nutrition that they need. And then to make sure that the health services that are important for children, like immunization, we have already some evidence that in some countries, because all the health resources, especially those with very underdeveloped health systems, because of the resources are all going to COVID response, they are reducing child immunization. And that will obviously have a big impact later on. And so you have to make sure the health services, the essential health services to children are going to be delivered. And then you have school. The studies are showing that 3 months out of school may be okay, but longer than 3 months, you're going to have long-term effects on learning and therefore on human capital. So how do you have children return safely back to school? That's a big question. And then if you can't have them all return to school, how do you, especially for poor, vulnerable households, how do you make sure that they can continue to learn through various means? And if you're talking about the poor household, they don't have computers, they can't do things online. So we have actually got a whole gamut of tools that have been used in the various developing countries, including old technology like radio, television. And then you need to also work with the teachers, right, to be able to deliver. And one thing that we also worry about is that when children start going back to school, the experience of the Ebola crisis shows that a lot of many children, because of work or because of poor income, because of low income, they don't go back to school. And a higher percentage of girls don't go back to school. So these are really our learning from past crises, and what we are already seeing happening, that we need to introduce policy interventions to prevent, right? So for instance, to make sure kids go back to school, you can tie the social assistance program of income cash transfers, for instance, to the fact that the children go back to school, for instance. That's just some example of how you could do it. But you are right, the issue, the fear of stunting, the fear of malnutrition, these are really, really serious issues that we have to prioritize in all our policy interventions, and that governments really, really need to prioritize. Otherwise, you are really going to be not future-proofing your road to recovery.
Thank you very much, Mari. You know, one thing that's impressed me about Mari is she's an economist by training, but since joining the World Bank in March of this year, she now speaks like a Minister of Health. So it teaches you that at the higher education level, the COVID-19 has forced her to suddenly be much more aware about health issues. That's very, very, very useful, I think, for the bank as a whole. And I think your mention about the reopening of schools, obviously that's the big unknown, and it's very consistent with the focus of the HEAD Foundation on educational issues. Big question, that one. Okay, I'm going to circle back to Adeeba. This is a question again from Ed Lau. Are you recommending that businesses should continue to mandate employees to work from home for an extensive period, maybe until a vaccine is ready? And what advice would you give to policymakers in terms of balancing life-saving versus livelihood-saving kind of policies? Okay, over to you.
Okay, so in terms of working from home, I think the first principle of containing COVID-19 is, of course, now that we know much more about it, is overcrowding and being indoors close to each other, not wearing masks, are all areas of risk that you want to avoid. So if your company or any company is able to continue and have people work from home productively, then that's something that should be considered, because having a lot of people in a confined space is what the risk is all about with COVID-19. Having said that, there are many occupations where working from home is not feasible. And just like with schools, there are situations and children, there are situations where, especially for smaller businesses, where people are endowed with access to internet and laptops and so forth. So I think it's a matter of companies weighing the risks and benefits. The other thing to consider is, of course, the risk during travel to work, particularly in public transport and so forth. As we move forward, I think one area where the scientific world hasn't paid as much attention is in the importance of ventilation, particularly in Asia, where we all now sitting in closed air conditioning room, perhaps in the post-COVID world, we have to go back to more and better ventilated rooms with fans and so forth. Which brings me, if I could touch on going back to school, some people have even spoken about perhaps classes should be conducted outdoors as they were during the Spanish 1918 flu pandemic. So, as I said, as we learn more and more about this virus, I think we hopefully we can adapt our response better and more effectively. The second question was in terms of policy, how do we balance livelihood versus the economics? Perhaps that question should go to Dr. Pangestu, but I think until and unless you get a good control of the pandemic, then it's very difficult to kind of focus on the economic recovery. So I don't think there is a, one or the other. Obviously you have to do both, but it would be very difficult to do the economic recovery without getting a good handle of the pandemic. So, as we've seen in the US, for instance, the rush to open up the economy has led to their inability to get a good grip of the pandemic. So I think the first focus really needs to be flattening the curve and getting as few infection as possible, and only then would it be possible to then return to some sense of normality, as we are seeing in our part of the world, as Professor Kishore mentioned earlier. So whilst you can't choose one over the other, but it's obvious that unless you control the epidemic, you're not going to be able to get a good grip of economic recovery.
Thank you very much, Adeeba. With regards to your answer to the second question of balancing lives and livelihoods, I think the other dimension is policies to sort of maintain what Vivian Balakrishnan referred to as social capital. I think what we've seen with resurgences in Europe, for example, after easing of restrictions, government policies must also require sort of, strong political will to, implement policies which may be necessary, but which may not be popular in terms of this caution fatigue that people referred to earlier. So I think there's an old saying that says, what is right is not always popular, and what is popular is not always right. So I think policymakers do face a difficult dilemma in balancing lives, livelihoods, and social equilibrium. So thank you for that. So I'm going to go back to Kishore. Okay, two questions from Serene So. The first one is, while the US has more people falling below the poverty line, do you believe that this reality will give China more clout in the future in terms of this shift in the balance of power? So that's the first question. The second one is more Singapore focused, and the question is, with Singapore and many Singaporeans investing in China through businesses and real estate, what is your opinion with regards to its future? So this is probably about Singapore-China relationships. So over to you, Kishore.
Well, it's certainly the United States is struggling. And there are two schools of thought. Let me be very frank, okay? One school of thought in the United States is that all the problems in the United States are because they made a mistake. They elected Donald Trump, who's not rational, who's not a good leader. If he's voted out, America will bounce back and it'll go back to normal and everything will be fine again. one school of thought, which I think is a dominant school of thought. But I subscribe to the second school of thought, which I actually try to describe in my book, that America today has a structural problem. And I use a word that is actually used by Paul Volcker, Martin Wolf, Joe Stiglitz. This structural problem is that America has become a plutocracy. And if you look at the data on the inequality in the United States, it's actually quite shocking. 60% of the wealth has gone to 0.1% of the people. It's actually quite shocking, the data. Please Google and check the statistics. So there's a structural problem. And so the political system in the United States is responding to the needs of the top 1% and not to the remaining 99%. And if America doesn't take care of this structural problem, as I say in my book, if it's a contest between a democracy and a communist party system, a vibrant democracy will defeat a communist party system. But if this is a contest between, in the US, a plutocracy, and in China, a meritocracy can outperform a plutocracy. Now that's something that's unthinkable, unmentionable in the United States. But as a friend of the United States, and I want to emphasize that we in Asia want to see a strong United States. A strong United States is good for the world. A strong United States is good for East Asia. And when I talk about the plutocratic dimensions, I'm trying to tell my American friends, you can bounce back, but you've got to solve your plutocracy problem. If not, China will do better. In the case of Singapore and China, I would say that those who have invested in China have done well, as you know, so far. And I think will probably continue to do well. But as you also know, and this I have to add this, and this is of course what we'll discuss in my book also, if this geopolitical contest gets worse, right? And if there's a greater bifurcation, not just in trade, in trade, in technology, in finance, there could be a really deeper canyon between China and the United States. So in the past, you could invest in China and export to the US, or invest in US, export to China. Suddenly you now have to deal with a much more complicated global economic picture. So for those who say they are investing in China, the simple advice I give is diversify. And that's what all major companies are doing. And that's why, if you notice, that's what they call reshoring of industries and so on and so forth. So certainly we should invest to a large extent also in China, but also diversify. And I think Singapore, from Singapore's national interest point of view, we must maintain good relations with China and we must maintain good relations with the United States. So we have to be able to get along with both, but I can assure you that's a very difficult thing to do.
Thank you very much, Kishore. I'm sort of aware of the time here. So in the last 10 minutes that we have, I'm going to begin by asking each of you if you have any sort of short concluding remarks and statements based on what you've heard today. And then I'm going to end up perhaps by making some sort of concluding statements. So any final words from the three of you? Let's begin with you, Mari.
Yes, I would just repeat what we see as kind of the frame for reproofing the road to recovery. What you do in the relief stage currently, as well as in the restructuring stage, is going to shape how you're going to be on the road to recovery, and that's across the board. Whether you're talking about the health issue or livelihoods and jobs, and how you protect or keep the lights on in the firms, keep the jobs, and then and the financial sector, and then restructure them, and then rebuild them with new investments to rebuild better, and across the structure of the country. And I would just emphasize that across all that, you can talk about physical capital, financial capital, as economists would. but economists also focus on this. I think you do have to focus on the human capital, because that is what I'm the most fearful of, that if we don't pay attention to that, you are going to have a lost generation. It's not just about loss of lives, but the future potential for growth and increased productivity and so on. So much lies on the human capital, and there's a health dimension, an economic dimension, an education dimension, and a social dimension, which we all need to work on in a coordinated and comprehensive way, and a very targeted and focused way.
Thank you. Certainly agree on the importance of human capital. Adeeba, some final remarks from you?
Yeah, so I think what we've learned in the last 4 to 6 months and previously from the HIV pandemic is there's no one size fits or a magic bullet, and that we must follow the science and tailor our responses accordingly. And most importantly, I think to not forget the vulnerable population and pay special attention to them, because if you don't, then it will be very difficult to control the pandemic, because it will be difficult to break the chain of transmission.
Thank you so much. Kishore?
Well, the Chinese, I'm told the Chinese word for crisis is very good. It's a combination of two terms, danger and opportunity. And I'm glad that we have focused on the dangers very, very clearly. But there are also tremendous opportunities. And I see at least two major opportunities from this COVID-19 crisis. First, going back to my boat analogy, just imagine if the four of us, Tikki, you, Mari, Adeeba, and I, were on a boat together, a small boat, and the boat catches fire. The stupidest thing we can do is to argue with each other. Who started the fire? You started the fire, you started the fire. First thing you do is put out the fire. Then you argue about who started the fire. So I hope that as a result of COVID-19, more and more leaders will realize that we are on the same boat. We should stop arguing about who started COVID-19. We should work together to take care of it. And the second opportunity is this. I hope that the younger people especially will speak out and tell their leaders, why are you playing 19th century geopolitical games? I mean, many of the people in the United States who are taking out these actions against China, they think they're shooting their cannons from one boat to another boat. Actually, they're shooting the cannons from one cabin to another cabin. And when you shoot the cannons from balls from one cabin to another cabin, you sink the boat, you also sink. So that's why it's very important to accept that we are on the same boat. And my sense is that the young people understand this and are saying, please, we have actually a great opportunity today to work together. And I want to emphasize a point that Steven Pinker from Harvard University makes, as you know, in his writings, in his book, Enlightenment Now. Today, we actually have the resources, the scientific resources, the economic resources, the human capabilities to completely eradicate human poverty. We have the resources if we cooperate to take care of the major ailments in the world. And we are on the verge of creating globally the healthiest human condition ever in human history. Going back to your health point, we have this great opportunity. So I hope as a result of COVID-19, we will seize that opportunity.
Thank you very much, Kishore. So thank you for those final remarks. My apologies to the many other questions that we haven't had time to answer. I'm just going to spend the last 2 or 3 minutes on some sort of concluding reflections. And I've learned a lot from Kishore in the sense that I'm just going to make 3 points. Okay. The first one, in answer to what does the road to recovery look like? The first one is I'm borrowing here from Kamala Harris, driven by what she calls a coalition of conscience and stark inequities. I believe recovery is about learning from the past, about agility, about a combined, balanced, and contextual strategies which leaves no one behind. in response to this balance that we talked about between lives, livelihoods, and social equilibrium. I think the balance and the context were nicely highlighted by the speakers today. The second point I'd like to make is that I think what Mary highlighted was that after lives are safe, recovery and rebuilding will be a long haul, okay? And importantly, be driven by citizens and communities. Like Kishore mentioned, it has to be a bottoms up, and you know, the idea of the young people doing something about this is another dimension of that. And guided by these sort of interconnected goals to protect the poor and vulnerable, to ensure business growth, and to strengthen the policies and the institutions. So that's the second point I'd like to make. The third point, final point I'd like to make is this thing here, okay, that when elephants fight, the grass gets trampled. And I think Kishore has made that point very, very nicely. So my third point is that as the West struggles, you know, superpowers bicker and global leadership is missing or is irrational, global solidarity and cooperation guided by multilaterals is critical more than ever. You know, and as Kishore mentioned, can Asia or ASEAN light a candle for the right path to recovery and to sort of collectively leave this sort of colonial mentality that he referred to. And, you know, going back to the wonderful boat analogy, and my final slide is what Martin Luther King said: we may have all come on different ships, but obviously we're in the same boat now. So that's it. Let me take this opportunity to thank the three panelists for their wonderful insights and contributions today. Let me thank all the participants that have asked those very insightful questions. And finally, of course, the HEAD Foundation for hosting this seminar. So thank you, everyone. Have a good day wherever you are in the world. And of course, take care and stay safe. This pandemic is still going on. Thank you very much, and goodbye for now.